The appendicular musculature of the muscular system. The appendicular muscles are responsible for stabilizing the pectoral and pelvic girdles, moving the upper and lower limbs, absorbing shocks and jolts as you walk, run, or jump, and aiding in strengthening the joint area. Two major groups of appendicular muscles exist. First, the muscles of the pectoral girdle and upper limbs. Second, the muscles of the pelvic girdle and lower limbs. The muscles that position the pectoral girdle originate on the axial skeleton and insert on the clavicle and scapula. The muscles that move the arm originate on the pectoral girdle and the thoracic cage and insert on the humerus. Muscles that move the forearm and hand primarily originate on the pectoral girdle and humerus and insert on the radius, ulna, or carpals. Extrinsic muscles of the hands and fingers primarily originate on the humerus, radius, and ulna, and insert on the metacarpals and phalanges. The intrinsic muscles of the hand originate primarily on the carpal and metacarpal bones and insert on the phalanges. The muscles of the pelvic girdle and lower limb include the muscles that move the thigh. These muscles originate in the pelvic region and typically insert on the femur. The muscles that move the leg originate on the pelvis and femur and insert on the tibia or fibula. Extrinsic muscles that move the foot and toes originate on the tibia and fibula and insert on the tarsals, metatarsals, or phalanges. The intrinsic muscles of the foot originate primarily on the tarsal and metatarsal bones and insert on the phalanges. There are a few factors that affect appendicular muscle function. One of these is action lines. For example, the action lines of the shoulder joint dictate the direction of pull, the flexion and extension at the shoulder joint, abduction and adduction at the shoulder joint, and the medial and lateral rotation at the shoulder joint. Here is a superficial lateral view with the action lines of the deltoid, biceps brachii, and triceps brachii. Analyzing how these action lines cross the shoulder helps you determine the actions of these muscles on the humerus. The acromion and clavicle are origination points for the deltoid. The entire deltoid will abduct the shoulder. The clavicular deltoid, which is positioned anteriorly, flexes and medially rotates the shoulder. The scapular deltoid is positioned posteriorly and will extend and laterally rotate the shoulder. The posterior triceps brachii will extend and adduct the arm. The anterior biceps brachii will flex the humerus. Another factor affecting appendicular muscle function is the existence of spurt and shunt muscles. These include the flexors and extensors, the spurt muscles, which are muscles that insert close to the joint, and shunt muscles, which are muscles that insert far away from the joint. The location of a muscle's insertion relative to the joint's axis of movement gives further details about the muscle's function at that joint. The primary action of a muscle that inserts close to the joint is movement of that joint. Such a muscle is termed a spurt muscle. However, a muscle that inserts further away from the point will stabilize that joint in addition to moving the joint. This type of muscle is a synergist and is termed a shunt muscle. The bicep brachii flexes the forearm at the monaxial elbow joint. This is considered a spurt muscle. The brachioradialis is a muscle located on the forearm. It provides stability and movement and is known as a shunt muscle. The triceps brachii is located on the posterior forearm and extends the forearm as well as providing torque. The triceps brachii is known as a spurt muscle. The third factor affecting appendicular muscular function is the action lines existing at the hip joint. These actions include flexion and extension, abduction and adduction, medial rotation, and lateral rotation. The hip joint, like the shoulder joint, is a multi-axial synovial joint that flexes, extends, adducts, abducts, medially rotates, and laterally rotates. The movement at the joint depends on the anatomy of the joint and its axes of movement. The gluteal group is superior to the hip joint. This entire group will extend and abduct the hip. The anterior muscles, including the gluteus medius and the gluteus minimus, flex, abduct, and medially rotate the hip. The anterior tensor fasciae latae does the same, flexion, abduction, and medial rotation. The posterior gluteus maximus extends the hip. The acetabellum is surrounded anteriorly by the adductor group. The adductor longus and adductor magnus will adduct the hip. Posterior to the acetabellum is the lateral rotator group. This includes the hamstring group that extends and laterally rotates the hip. The iliopsoas runs lateral to the sacrum and attaches to the femur and flexes the hip. The gluteus medius and gluteus minimus abduct the hip. The obturator externus will laterally rotate, and the tensor fasciae latae will medially rotate the hip. The adductor longus adducts the hip, and the posterior hamstring group extends and laterally rotates. The action lines of the adductor magnus extend from the shaft of the femur to the pubic bone. The muscles associated with the pectoral girdle and upper limbs can be divided into 4 groups. First, muscles that position the pectoral girdle. Second, muscles that move the arm. Third, muscles that move the forearm and hand. And fourth, muscles that move the hand and fingers. The muscles that position the pectoral girdle also coordinate with the muscles that move the arm. These are the trapezius, the rhomboid, the levator scapulae, the pectoralis minor, the serratus anterior, and the subclavius. The trapezius functions to rotate the scapula and extend the neck. The rhomboid adducts the scapula. The levator scapulae elevates the scapula. The pectoralis minor protracts the shoulder. The serratus anterior protracts the scapula, and the subclavius function to protract the shoulder. The muscles of the pectoral girdle and upper limbs include the muscles that move the arm. These include the deltoid, the supraspinatus, the infraspinatus, the subscapularis, the teres major, and the teres minor. The deltoid abducts the arm. The supraspinatus abducts at the shoulder. The infraspinatus laterally rotates at the shoulder. The subscapularis medially rotates at the shoulder. The teres major is responsible for extension and medial rotation at the shoulder, and the teres minor is responsible for lateral rotation and adduction at the shoulder. The muscles that move the arm include the coracobrachialis, which performs adduction and flexion at the shoulder, the pectoralis major, which adducts, flexes, and medially rotates the arm, and the latissimus dorsi, which extends, adducts, and medially rotates the shoulder. The rotator cuff muscles include the supraspinatus, infraspinatus, subscapularis, and teres minor. The muscles that move the forearm and hand include the extensor carpi ulnaris, the triceps brachii, the biceps brachii, the brachialis, the brachioradialis, the anconeus, the pronator teres, and the supinator. The extensor carpi ulnaris extends and adducts at the wrist. The triceps brachii extends the arm at the elbow. The biceps brachii are in charge of flexion at the elbow and works in part to supinate the forearm. The brachialis and brachioradialis both are responsible for flexion at the elbow. The anconeus is responsible for extension at the elbow, whereas the pronator teres pronates the forearm and the supinator supinates the forearm. The muscles that move the forearm and hand include the flexor carpi ulnaris, the flexor carpi radialis, and the palmaris longus. The palmaris longus is responsible for flexion at the wrist. The flexor carpi ulnaris is responsible for flexion and adduction at the wrist, whereas the flexor carpi radialis performs flexion and abduction at the wrist. The muscles that move the forearm and hand include the extensor carpi ulnaris, the extensor carpi radialis, and the pronator quadratus. The extensor carpi ulnaris extends and adducts the wrist. The extensor carpi radialis extends and abducts the wrist. This includes both the extensor carpi radialis longus and the extensor carpi radialis brevis. The pronator quadratus pronates the forearm and hand. The muscles that move the hands and fingers include the extrinsic muscles of the hand. These muscles are found mostly in the forearm and include the abductor pollicus longus, the extensor digitorum, the extensor pollicus brevis, the extensor indicus, the extensor digiti minimi, the flexor digitorum superficialis, the flexor digitorum profundus, and the flexor pollicus longus. The tendons of these muscles pass through the synovial tendon sheaths, which are located at the area of the wrist. The muscles that move the hands and fingers also include intrinsic muscles of the hand. These muscles are found mostly in the palm or dorsum of the hand. These include the adductor pollicus, the opponens pollicus, the palmaris brevis, the adductor digiti minimi, the abductor pollicus brevis, the flexor pollicus brevis, the flexor digiti minimi brevis, and the opponens digiti minimi, along with the lumbrical, the dorsal interossi, and palmar interossi. There are also compartments and sectional anatomy of the arm and forearm. The anterior compartment holds the biceps brachii, brachialis, and coracobrachialis muscles. The posterior compartment houses the triceps brachii. The forearm is divided into 4 compartments: the superficial anterior compartment, the deep anterior compartment, the lateral compartment, and the posterior compartment. The superficial anterior compartment include the muscles, the flexor carpi radialis, the flexor carpi ulnaris, the flexor digitorum superficialis, the palmaris longus, and the pronator teres. The deep anterior compartment houses the muscles, the flexor digitorum profundus, the flexor pollicus longus, and the pronator quadratus. The lateral compartment houses the brachia radialis, the extensor carpi radialis brevis, and the extensor carpi radialis longus. The posterior compartment houses the abductor pollicus longus, the anconius, the extensor carpi ulnaris, the extensor digitorum, the extensor digiti minimi, the extensor indicus, the extensor pollicus brevis, the extensor pollicus longus, and the supinator. The muscles of the lower limbs are larger and more powerful than those of the upper limbs. The muscles of the pelvic girdle and lower limbs can be divided into 3 groups. First, the muscles that move the thigh. Second, the muscles that move the leg. And third, the muscles that move the foot and toes. The muscles that move the thigh originate on the pelvis. Many of these are large and powerful and fall into 4 groups: the gluteal group, the lateral rotator group, the adductor group, and the iliopsoas group. The muscles that move the thigh include the gluteal muscles. The 4 gluteal muscles include the gluteus maximus, the gluteus medius, the gluteus minimus, and the tensor fasciae latae. The gluteus maximus extends and laterally rotates at the hip. The gluteus medius is in charge of abduction and medial rotation at the hip. The gluteus minimus, the gluteus medius, and gluteus minimus both function for abduction and medial rotation at the hip. The tensor fasciae latae performs extension of the knee and lateral rotation of the leg. The muscles of the pelvic girdle and lower limbs include muscles that move the thigh. This includes the lateral rotator group. The lateral rotator group has the following four muscles: the obturator muscles, piriformis, and gemelli muscles, which all function to laterally rotate and abduct the hip, and the quadratus femoris, which performs lateral rotation of the hip. The muscles of the pelvic girdle and lower limbs include muscles that move the thigh. The adductor group of these muscles includes the adductor brevis, adductor longus, adductor magnus, pectineus, and gracilis. The adductor brevis functions to adduct and flex the hip. The adductor longus is in charge of adduction and medial rotation at the hip. The adductor magnus adducts at the hip. The pectineus performs flexion and adduction at the hip. The gracilis is responsible for flexion and medial rotation at the knee, as well as adduction and medial rotation at the hip. The muscles that move the thigh include the iliopsoas group, which includes the iliacus and the psoas major. Both of these perform flexion at the hip. The muscles that move the leg include the extensors of the knee, collectively called the quadriceps femoris. The quadriceps femoris includes four muscles: the vastus intermedius, vastus lateralis, and vastus medialis, all of which function to extend the leg, and the rectus femoris, which extends the leg and flexes at the hip. The flexors of the knee are collectively called the hamstrings and includes the biceps femoris, semimembranosus, and semitendinosus muscles. The semimembranosus and semitendinosus muscles both function to flex the leg, whereas the biceps femoris both flexes the leg and extends at the hip. The flexors of the knee include the sartorius and the popliteus. The sartorius allows for crossing of the lower leg. It flexes and abducts and laterally rotates the hip. The popliteus medially rotates the hip. The muscles that move the foot and toes include the extrinsic muscles of the foot and intrinsic muscles of the foot. The extrinsic muscles of the foot are muscles that originate on the distal end of the femur or on the tibia or fibula, but yet move the foot and toes. Intrinsic muscles of the foot are muscles that originate on some aspect of the foot itself, but yet move the toes. The extrinsic muscles of the foot include the tibialis anterior, gastrocnemius, fibularis brevis, fibularis longus, plantaris, soleus, and tibialis posterior. The tibialis anterior is responsible for dorsiflexion and inversion of the foot. The gastrocnemius, plantaris, and soleus perform plantar flexion. The fibularis brevis and fibularis longus perform plantar flexion along with eversion of the foot. And the tibialis posterior performs plantar flexion and inversion of the foot. The muscles that move the foot and toes include the extrinsic muscles of the foot. These are the flexor digitorum longus, the flexor hallucis longus, the extensor digitorum longus, and the extensor hallucis longus. The flexor digitorum longus flexes the toes 2 through 5. The extensor hallucis longus performs flexion of the hallux. The extensor digitorum longus extends the toes 2 to 5, and the extensor hallucis longus extends the hallux. The intrinsic muscles of the foot include the abductor hallucis, the flexor digitorum brevis, the abductor digiti minimi, the lumbricals, the flexor halluci brevis, the flexor digiti minimi brevis, and the plantar aponeurosis. The abductor hallucis abducts the hallux, whereas the flexor hallucis brevis flexes the hallux. The flexor digitorum brevis performs flexion of the toes 2 through 5, whereas the lumbricals perform extension of the toes 2 through 5. The abductor digiti minimi abducts the little toe, whereas the flexor digiti minimi brevis performs flexion of the little toe. The lumbricals perform the extension of toes 2 through 5. The intrinsic muscles of the foot include the quadratus plantae, which flexes the toes 2 through 5, the adductor hallucis, which adducts the hallux, and the plantar interossei, which adducts the toes 3 through 5. The intrinsic muscles of the foot include the extensor digitorum brevis, which extends the toes of digits 1 through 4, and the dorsal interossei, which function to abduct the toes 3 and 4 and extends toes 2 through 4. The thigh is divided into 3 compartments: the anterior, posterior, and medial. The anterior leg is sectioned into 4 places to reveal its compartments. The horizontal section through the proximal thigh shows the anterior compartment. The anterior compartment houses the rectus femoris, vastus lateralis, sartorius, vastus medialis, and the femoral artery, vein, and nerve. The medial compartment contains the adductor longus and adductor magnus. The posterior compartment contains the sciatic nerve and the biceps femoris and semitendinosus. The posterior compartment borders the gluteus maximus. The medial compartment contains the adductor longus and adductor magnus. The posterior compartment contains the sciatic nerve and the biceps femoris. The lower leg is divided into 4 compartments: the anterior, the lateral, the superficial posterior, and the deep posterior. Thank you for watching.